me. There we go. Thank you for the introduction. I've met some of you, but I have not had the pleasure of meeting all of you yet. So I'm Dr. Lily. I have been in the practice for about 2 months now. I'm very happy to be here. A little bit about me. I am from a little town called Ronas over here in the Monterey Bay area of California. I did my undergraduate at Humboldt State University, and then I went farther north to Washington State University for vet school, where I realized I really don't like 4 seasons, and then I came running back to California and did my internship at Pioneer Equine, which is in Oakdale, California, a little bit south of here. Outside of work, I like to do all sorts of things, outdoor adventure, so boating, and fishing, mountain biking, that kind of thing. This is my partner Dylan. He is out fishing right now. This is our cat Delmar. And before I started this job, we were in Mongolia for 3 weeks riding horses in the mountains, which was the best thing I've ever done, and highly recommend. So, to get into our topic, my outline for tonight will consist of a little overview of the anatomy of the nervous system, the goals of a neurologic examination, kind of our process of working up neurologic disease, and then we'll get into kind of the nuts and bolts of the neurologic exam. So to start with the anatomy. The nervous system has 2 main parts that you've probably heard of, the central nervous system and the peripheral nervous system. The central nervous system is made up of the brain and the spinal cord. And the peripheral nervous system can be broken down in various ways, but tonight we'll kind of think of it as the cranial nerves, so the nerves that sit in the brain and innervate the skull and the face, and then sensory nerves and motor nerves that go to all the muscles and skin of the body. The goals of a neurologic exam are kind of to answer 3 main questions. So the first question, which is kind of utmost important to you all, is does this horse have a neurologic disease, or is my horse neuro? And that is not always the most clear-cut question to answer. Secondly, more important to us is where is the problem? So in the anatomy of the nervous system, where is this? Because as you can imagine, a problem in the brain versus a problem in a nerve in the leg is kind of a very different disease. And we call that neuroanatomic localization. And then number 3, which is also very important to you all, is this horse safe to ride? And what do we need to do to figure out if the horse is safe to ride, and could it be safe to ride in the future? So kind of the process that we go through for working up neurologic disease starts the way kind of every appointment starts, with a detailed history. So kind of the lifestyle of the horse, their diet, what medications they're on, vaccination history is very important, and then the timeline of the problem. So did this kind of all pop up particularly yesterday, or has this been kind of building over the course of months? We always do a physical exam, so evaluating all of the rest of the body systems to know kind of everything that we're dealing with currently with the neurologic problem. And we often pair a neuro exam with a lameness exam, because sometimes it's not always clear to differentiate a problem in the musculoskeletal system, so like a traditional lameness that we're probably all familiar with, versus neurologic disease. We'll do our neurologic exam, which I will get into in a minute here, and then often we're doing further diagnostic tests, such as imaging, lab work, and plus or minus referral to a specialist. So to talk about the neurologic exam, my topic of the evening, there's kind of 2 parts to an equine neurologic exam. We start with a static exam, which consists of observation of behavior, posture, we'll go through the cranial nerves, and palpation of the whole body. Symmetry is very important, though, be a recurring theme. Is the horse the same on one side and the other? Because as you know, all mammals should be symmetrical. And DE will also check range of motion of their neck at that time, and then segmental reflexes down the spine. So checking the nerves at each spinal segment to see if the reflexes are intact. Then we get them moving in the dynamic exam. So this is probably what you all are familiar with when we kind of get them moving. We check their gait, proprioception, which I will get into what that is, and then their strength side to side. Importantly, in horses, their neurologic examination is quite different from what we may have experienced in our own doctor's office, or what we can even do with small animals, because of just just their size and the practicalities of doing an exam on the standard creature. Very importantly, you will never see one of these in an equine veterinary neurologic exam. It's just not practical for horses. So, I won't walk you through the whole thing. Neurology is a whole semester topic in veterinary school, and this is the form that I've used in the past for doing a neurologic exam. And there's all these little boxes, things to check on the right and the left. And so I won't bore you with all of that tonight, but just know that this is kind of the process we're going through when we do a neurologic exam on your horse. It's a very detailed, structured exam to look at every part of the anatomy of the nervous system and the reflexes and responses of the nerves that we expect to be there. At the end of the exam, we assign them an ataxia grade. I'll talk about what that is. And then we assign them a neuroanatomic localization, so where the problem is. We make a list of differential diagnoses and a plan going forward. So to start with our static exam. This starts when I first lay eyes on the horse. Maybe we're chatting, but I'm looking at your horse and just kind of observing their behavior from afar before I start messing with them. So, does the horse behave normally at rest? I expect a horse, that I'm seeing for the first time to look kind of like this. They should be paying attention to me, their ears should be pointing towards me, maybe a dog barks somewhere, they're flicking ear towards that, and it comes back to me. So is the horse responding normally to sensory stimulus from their environment? Or, do we see this horse? Not normal. Especially if you hauled in a horse to our office, they should be pretty keyed up. They should be very aware of their surroundings. Not like this. Alternately, is a previously sweet horse now acting more like this. That's a serious change that we want to keep it out. Other things we might observe is that are kind of big red flags to us. Are they dribbling urine? Do they have kind of twitching of their face or other muscles in their body? So that's things we take note of before we start laying hands on them. I should, as an aside, I have shamelessly poached all of these pictures from the internet, Google Images. I did not take any of them. Again, before we lay hands on the horse, we are observing their posture and symmetry. So, the next few slides, I'm just going to have some pictures of examples of things we might see, not a comprehensive list of everything we could possibly see wrong with posture and symmetry of a horse. But as you can see here on the left, this horse is standing quite base narrow in the front, and it's got this right leg kicked out in the back. If this horse kind of voluntarily put itself in this position without kind of being stimulated to do so, that's not normal. That's something to take note of. This little foal in the middle is got a head tilt at rest, so like it doesn't quite know which way is up. That's a significant finding. And then this horse on the right is standing what we call an elephant on the ball stance, so the legs are kind of camped in on both sides rather than straight up and down the way they should be. So that's something also to take note of that can be a sign of various things, but is on our list for neurologic disease. Next, we actually get up and touching the horse, so we'll go through a cranial nerve exam, kind of starting head to toe. So there are 12 pairs of cranial nerves. They're kind of the bane of the existence of first-year veterinary students having to memorize them all. And there are specific reflexes and responses that we can test to go through each of those 12 nerves and see if they're working correctly. The first one is the olfactory nerve, that is for smell. Harder one to test, but we can if we need to. You can see here, this clinician is looking at a horse's eyes. Cranial nerves 2, 3, 4, 5, 6, and 7 are all involved in the eyes. So looking at the eyes is a very important part of a cranial nerve exam. This horse in the middle is showing some pretty classic signs of cranial nerve 7 dysfunction. So you can see the muzzle is deviated over here to the left. The left eye is held more open than the right eye. The right eye is a bit droopy. And then the left ear is up and the right ear is drooping. So this is all pointing towards dysfunction of the muscles of facial expression on the right side, which are controlled by cranial nerve 7. Likewise, this horse has its tongue out, so that's probably a problem with cranial nerve 12, which controls the tongue. You'll often see us in the course of a neurologic exam, looking in the horse's mouth and pulling the tongue out to either side, so the control of the tongue, all the actions of swallowing are controlled by cranial nerves, and we kind of assess those in the process of a cranial nerve exam. Next we move on to the rest of the body. So palpation of the whole body, are things normal? Is the horse painful anywhere? Are there asymmetries left to right? And does the horse respond to stimulus the same on both sides? So you can see here some abnormalities we might find, so some muscle atrophy. This is kind of a classic Sweeney shoulder, familiar with that condition. There's a particular nerve that innervates this muscle that can get damaged if they kind of bonk their shoulder in a particular way, and that results in atrophy there. This is a very dramatic gluteal muscle atrophy, so you can see there's no muscle here, and there's normal muscle on this side. So there's particular nerves that innervate those muscles that are not working in this horse. And then over here on the right, this is showing the where we test all of the spinal reflexes going down the horse's body. Next, we get the horse moving in the dynamic exam. And this is probably, when I say neurologic exam, if any of you have seen your horse go through a neuro exam, this is probably what you think of. So we get them moving in all sorts of kind of silly ways. So we circle them in tight circles both directions. We walk them up over curves and up hills, and we walk them out and pull on their tail both directions. Sometimes we even blindfold them and do those things, or hold their head up and make them walk like that, or back them. And basically what we're looking for in all of this is these four things. So ataxia, which is incoordination, paresis, which is weakness, spasticity, which is stiffness, and dysmetria, which is abnormalities of the range of motion. So whether they're not moving enough or they're moving too much. So some of you may be familiar with like shivers or string halt, where horses have really dramatic motions in their hind legs, and so that would be hypermetria, which is too much movement of their hind legs. The tail pull test, which is kind of one of the weirder ones to watch, is looking for paresis, so weakness side to side. So they should be able to pull back against us, and they should pull back against us the same amount on both sides. So the main goal with all of that is to assess proprioception, and that's a big word that means awareness of the position and movement of the body. So in other words, does the horse know where its feet are in space? And this is of great importance to you all, because a horse that is brain is not connected to its feet, doesn't have a good awareness of where its feet are in space, is a horse that's not safe to ride. And as you can imagine, is not safe to go around a jumper course or go through complex terrain on a trail ride. So that is the big goal with all of this dynamic exam. So some examples here of testing proprioception. We can move the horse's legs, we call this a placement test, into abnormal positions and see if they will correct it on their own kind of reflexively. So you can see this horse over here has got its right front leg kind of placed abnormally and is not replacing it. And they can be a little bit subjective because some of your horses are very well trained and they think, oh, I'm going to put my foot over here and that's where it should be, and I'm going to be a really good boy and keep it there. So we kind of have to take everything into account. But if they were tripping on a certain leg and we were walking over curves and then their placement test is abnormal, we kind of put more weight when we have more evidence towards a particular problem. Lastly, at the end of a neuro exam, we assign a horse an ataxia score. So ataxia is impaired balance or coordination. There's drug walking. Hopefully, many of us have experienced this in field sobriety test, but that's basically what we're doing with horses. And there is a scoring system for ataxia. So 0 is normal. Horse is very well aware of where their feet are and places them correctly every time. 1 is very difficult to detect. It basically takes a very experienced observer to call ataxia in that horse. Number 2 is obvious at normal gaits, but only when asked to perform complex tasks. So maybe when they're walking on flat ground, they're totally fine, but when we start getting them up over hills and curves and things, they start making mistakes. grade 3 is obvious walking in a straight line. So this is when we start getting into horses that are not safe to ride, or they're kind of weaving around and tripping themselves on flat ground in a straight line. Number 4 is profound deficits, may stumble or fall. These are horses that are pretty scary to be around, and they could fall on you kind of unpredictably. And then ataxia grade 5 is when they're down and they're not able to get up, they're so neurologic. Dr. Ian is going to discuss all of this in much more detail in her section. So at the end, back to our goals of a neurologic exam. At the end of our exam, hopefully at the very least we have answered the question, yes or no, does the horse have neurologic disease? To where in the anatomy of the nervous system is the problem, and then is the horse safe to ride? With that, thank you. I'll have questions held to the end.